Welcome everybody. Welcome back to the series Understanding the New Charter of Aged Care Rights, proudly brought to you by OPAN, the Older Persons Advocacy Network. My name is Marie Montgomery and I am your facilitator for this webinar and for your community events, which I'd really love to see everyone at. And we're going to play a little video now of welcome. Wonderful. That's a great little video, and you'll see snippets of this video throughout the webinar today. The characters really come alive and they tell about the Charter quite simply. It's quite lovely. Your time is very precious and your participation and voice is absolutely pivotal, so please send us any questions or any ideas that you have that we can help drive the new Charter of Aged Care Rights and your aged care. My name, I've said that, haven't I? My name is Marie Montgomery, but I would love to now move across to the panel and introduce this amazing panel that we have with us today. I've got Nailika Padmansina on my left here. You're a solicitor for Seniors' Rights Service?
Yes, I am.
Good, good. And Pat Joyce, the Advocacy Manager for Seniors' Rights Service.
Thank you. Hello.
Great. Maria Berry. Maria is a consumer representative and the founder for Communities of Respect. And Craig Gear. Craig Gear is the CEO of OPAN. So I'd love to welcome you all. Thank you so much for your time.
Thank you.
Nailika, and to all my other panel members, what is it that really, what brings you here today? What is the background, I guess? And also, what are you passionate about aged care?
Right. I'm a solicitor with Seniors' Rights Service, a member organisation of the Community Legal Centres. And we are a unique organisation where we provide legal advice and aged care advocacy to the recipients of Commonwealth funded services. And my, as a role, as a solicitor, so my specialist area is working with the residents in retirement villages. And retirement villages residents also receive care packages in their retirement villages.
Okay.
So my passion is overall in terms of protecting their rights in receiving their services.
Yeah, beautiful. I believe you also were honoured with the New South Wales Premier's Multicultural Award in 2015. That's quite an award. Can you tell us quickly?
Yes, it is. I'm very honoured to receive that. Before coming to this role, I was working in the women's health sector as an anti-violence worker, and also I have a background in social work. Working with women who went through quite a lot of violence issues and protecting and also talking about domestic violence, and particularly the women from diverse background, and giving them how to access legal services. So that's what's the background to this award.
Yeah. Such a pivotal role. You're a voice for many, that would find navigating aged care services quite difficult. So thank you so much. Yeah. Pat.
Hello.
Hello. Welcome back.
Thank you.
Excellent. Tell us about yourself, Pat, and your passion for aged care.
Thank you. Well, I come from a background of nursing, and a lot of that is in aged care and rehabilitation. And I've been an aged care advocate for about 12 years now. So that is my passion, working with older people and giving them the information to empower them and to keep them engaged and in control of their lives and improving their lives. So that's what Advocacy does, specifically for people receiving home care packages, home support, residential care, because it's a different environment and they don't often speak up and they don't understand. It's a very complicated system, even when you're in it and working in it. So it's great to give these folks some support and their families as well. And we do a lot of that through education sessions for older people receiving care and services, thinking about aged care, planning for the future, and also education for staff about rights. So it's all about rights. We're a rights-based organisation.
Absolutely, that empowerment is so important.
Thank you.
Yeah. Maria Berry, tell us a little about yourself.
My background is in nursing, aged care, which I've always loved and been very passionate about. For the last 10 years I've been a volunteer health consumer representative and an advocate for older people. And I've also been a consumer trying to navigate our current health system with ageing parents. And that's brought me here today. And also the huge honour and having a rural, regional voice come on the table here. So thank you.
We're mic'd down today, so I do apologise. We'll be going between each other, but that's okay. We're a team.
We can work through this.
Absolutely. Craig,
Hi.
welcome back. Thank you so
Thank you.
much for your support on these webinars. Tell us a little bit about your background and what is it you're so passionate about?
So my background is in health as well. Started off nursing. So we've got lots of nurses who are passionate about health and aged care. I think there's something in the blood or in the water.
Yeah.
Where our organisation, the Older Persons Advocacy Network, is running the Commonwealth's Aged Care Advocacy Program. And that is people like Pat who are out there every day helping people to have a voice, to raise that voice with aged care providers and to actually live the best life possible in aged care. And I feel very privileged to be in the role of CEO to actually be able to help bring aged care advocacy out in the open and for older people to understand that they've got someone there that's there on their side, there to support them, there to help them resolve any issues they may have and help them, as Pat talked about, is navigate what can be a little bit of a complex system. So I think we've got some great work going on there.
Absolutely, excellent. And it's all about empowering and finding a voice and letting you drive the care that you require. I'd also like to take this opportunity to acknowledge the traditional owners of the land, the Gadigal people of the Aurora Nation, on which we are meeting here today. I pay my respects to elders past, present and emerging, and for any other elders in communities that may be joining us across Australia today. So I guess by attending this webinar today, we would like to let you know what you'll be covering. So we're looking at what are and what they involve, who is OPAN, what is an advocate, because that's a very important subject, the Charter of Aged Care Rights and the new aged care quality standards and how they align. We'll be looking at the signing requirements of the Charter, consumer responsibilities, and also some resources, wonderful resources that OPAN has created and are delivering. So again, we are filming this today and we would love your Q&A if at all possible. Your voice is absolutely pivotal in the future of aged care. So I'm going to go to Craig now. Craig, our CEO, I'm going to ask you, who is OPAN and why are they involved in the rollout of the new Charter of Aged Care Rights?
Sure. So I touched a little bit on that, and but I suppose to get to the specifics, OPAN is made up of 9 member organisations, and each of these organisations have been providing aged care advocacy for around about 25 and some up to 30 years. So what these organisations do, they've got information, they provide education sessions, and they provide direct support to older people and their families, those who are receiving aged care, and also the people that might be potentially moving into aged care over time. that aged care advocate is a really important person, someone to stand beside you, walk beside you, take direction from you about how you want issues dealt with. And those issues are fundamentally about making sure that your rights as an Australian citizen are respected and that you're respected as a person. So OPAN is there to make sure those rights are upheld, alongside the Aged Care Quality and Safety Commission as well. And fundamentally, I suppose what this is about is understanding that we have rights as part of someone who's receiving aged care. And so because we're out there fighting for the rights, that member organisations like Seniors Rights Service are doing that as well, we saw it as a really natural fit to be out there talking about these rights and bringing the new Charter of Aged Care Rights to life.
Beautiful. Excellent. So the new Charter of Aged Care Rights places the consumer, or yourself, in the centre of care and acknowledges your dignity and respect. When we talk about advocacy and advocacy services, we all sort of have a very similar but unique little perspective on what that means to us when we assist and empower older people. Nalika, what's an advocate?
Well, when I'm talking about, as a worker within the organisation, the advocate is someone, walking through with the person, side by side, walking them through, whatever the complexities they're facing. But when it comes to different communities, the diversity, we all come from different, we all have different legal backgrounds, the legal systems, and also the understanding and the interpretation of, various legal terminologies. So then it will be a good example is recently when we were working with an Italian community member.
Yeah. So
the advocate is a lawyer, in their system.
Okay.
So then their expectation was that the advocate then provide legal advice.
Okay.
So then we have to explain the differentiation between the, when we advertise in the Seniors Rights Service is a legal service and an aged care advocacy. So then you need to differentiate, what the advocacy means. So, again, it is the understanding of the service provider as to, where we stand and where the, current, now it's the consumer, the person who is receiving the services. So this is a very complex area we are talking about.
Yes.
And also then the individual cultural upbringing also come into play in that scenario.
Absolutely. It's quite nuanced, isn't it, across the board? Yes, absolutely. Hence the question, because I think every panellist has given us a different snippet or a different perspective, which has just been fantastic. So I'm learning a great deal about advocacy along the way as well. Thank you. Pat, I know you're extremely passionate about advocates. So what do you see? Sorry, as the role of an advocate?
So an older person receiving aged care services can ask anyone to be their advocate and help them speak up and raise issues. In different situations, it could be a family member for one situation, it could be a community member for another, and for specific aged care issues, you may access an aged care advocate. So we know about your rights, the Aged Care Act, anything at all, how to communicate, how to raise concerns, and that's what an advocate does, as Nalika alluded to. We stand beside the person, give them some information or help them in the family, get the information they need, raise any concerns early so they can sort that out and move on. And that's very empowering to have someone stand by you if you're older and frail, and you may have fought your own battles in the olden days when you were strong and were supported by family and friends and peer groups. but now you maybe not many friends or family around to help you, so we can step in then, and we're free and confidential. So we just would take instructions from you. We give you some information about the options, and there's always options. There's always a solution, or if not, there's always an explanation why things need to be done this way, can't be done another way. So we could negotiate some outcomes and work with you if anything comes up. And things will come up in aged care. Communication, there's always something that we could improve. And if it helps you, then it's probably going to help the other people receiving services from the organisation assisting you. So it's aged care is looking better and better all the time because people are thinking up greater ways to respond to your needs. So, and if we or the aged care providers don't know what your needs are, we can help you raise those issues and help you even identify what you need. You may not have been asked before. So it's a great opportunity.
Yeah, I agree. The more voice we have, the more that you lead the aged care going forward, the better for yourselves and everyone. Beautiful. And you're right, it's community as well. So if one person gets an advocate, they're bound to be talking about that with somebody else. So yeah, it does spread. Word of mouth, it's always very powerful. Maria Berry, you're a consumer representative, so you're an advocate constantly, aren't you?
I certainly am, Marie. And I guess coming from a grassroots level has been fantastic. I think I've been given the title as the community advocate.
Yeah.
And I think it's from bringing out my own experiences and stories which are real and lived and developing that community trust. I've had a lot of people come forward that once were very fearful to say anything, but now if I go into the supermarket, I'm quite often there for an hour. I get tapped on the shoulder and someone saying, I've got a story or an experience. And my belief is that, but without OPAN and all senior rights and all this great work, we can't do it on a grassroots level. We've got to work together, and that's why it's really important to have this framework. And I guess I'm a little bit of a connector there, and Marie was kind enough to come down to World Elder Abuse Awareness Day in Wangaratta for an event, and that's really opened up the door in the conversation and being a connector for your organisations as well. So yeah, it's just important that my favourite saying is we do it best when we all work together.
Yes, too true. And Craig, I guess for you, what is an advocate? I know that you've discussed that briefly with OPAN. And what is OPAN? But just what are your thoughts on advocacy?
Yeah, I think the advocate role, it's something that's emerging over time, and as we'll get to the Charter of Rights and some of the aspects of that talk around advocacy and an advocate, and it is someone that I suppose gives you the confidence to say what you want. To set your expectations, to talk to it might be even internal to your family that the advocate can help as well, and especially with then interacting with your aged care provider, that's where it can really help. I think it is such an important, valuable role. It's different to having someone do things to you. They are always taking direction from you. They are there to say, you've got the right to this as an Australian citizen. And you've got a right to this as someone who's paid taxes, who's receiving aged care. And so they're advising you. But what I love about the advocacy approach is that it's about your say, about what you want to say, and it's also about empowering you to stand up. So we see that it's so important for the older people in our communities to be respected, to be appreciated, to be valued. And that dignity continues, and that's why I'm so passionate about this Charter of Aged Care Rights, because it does push us that way to actually say, here's the framework, here's the protections that are there for that, and that is something that our aged care advocates use every single day in their work.
Yeah, absolutely. It's a huge communication tool particularly for our vulnerable older people that may be unwell and maybe not able to have a voice. They can simply just use that tool. Beautiful.
It's a shield and a protection, we'd like to say. Yes.
It is indeed. So
Yeah.
the next question that I'll be looking at and we'll be extrapolating just ever so briefly are what are rights? And it's often not until a right is being infringed upon or that we have noticed that it's gone that we understand how important that right was. And I have to say, personally, undertaking this role, I've done a lot of personal reflection into what are rights and what particular rights are important to myself. I'm going to go to you, Craig, first, because you've got the mic, but you've got the knowledge as well. So, what do you think rights are?
And it's funny because it's really until you start thinking about it, you go, well, what are rights and what is a human's right? We talk about that we come from a rights base in our organisations, but it's really hard to articulate. And I suppose I see it as it's an expectation. This is what you can expect as a citizen of a country, or as a citizen per se. And I had the chance to visit the Jewish Museum in Sydney.
Okay.
And in visiting there, they had a history of human rights across the ages and where the United Nations had come from and those sorts of things. And they'd had children come in and actually write down what did it mean for them. And it was things like, it means you will respect me. It will mean that you will treat me like a human being. And those sorts of things. So simplistic things like that. But it was articulated to us, it's only when those rights are infringed on or when they're taken away that you realise how important they are. Yeah. And they are that expectation setting, as I said, but they are also there about a protection. This is what I can expect. This is the protections I can expect. So I think that they're vital, but we don't appreciate them enough.
Nalika, I can see you nodding and nodding away there.
Yeah.
What are rights to you? And I mean,
well, when you coming from the legal framework, it is the fundamental freedom. But then also when you're talking about individual countries, then you are bound by various legislations, various treaties, and this quite a lot of boundaries there. But then the fundamental thing is that you need to have a proper shelter, the dignity. What's the dignity means? It's about your respecting your beliefs, respecting what individual needs are, and also your care and that's a fundamental expectation, as Craig said. But then when you're looking at the UN principles for all the people, there are four main things that they're talking about. It's the independence, the older person's independence, and then the participation, and the self-fulfillment and dignity. So these
important.
are four things, the four rules of all the person's fundamental human rights.
Beautiful. Yeah. If either of you have anything to add to that one? No? No. Okay. So we're going in now to the Charter of Aged Care Rights. So the Charter, which is effective 1st of July, is a series or a number of rights, 14, and it's a new and simpler charter. Previously we had 4, which would cover many different areas of aged care services, and we've rolled that into 1. So I guess I'm going to go to you, Craig, first. What is the new Charter of Aged Care Rights?
Yeah, so the Charter is 14 statements about, as I said, expectations, how you as an individual are put at the centre of your care and the services that you provide, and then saying back to your provider, this is how I think these things should work. So I expect to have my independence maintained. I expect that my cultural background and my cultural diversity will be respected and actually celebrated as well. That I've got the right to privacy, that got the right to understand information about myself. So these things were there in the I suppose the legislation and in the the Aged Care Act before, but because it sort of often got slipped in as part of a funding agreement or a service agreement between the provider and the older person, it often got lost, I suppose. Okay. What this is now doing is bringing this right up front. Is we've got a new single quality framework and quality standards, and this is kind of putting it right alongside that to say, here's the standards and this is what it means for you as an older person. So I think that's really important that we're moving the conversation around from being just about how services are provided, but I suppose the essence that sits behind that of respect and dignity in how they're provided as well.
Okay, good. We will touch on the new aged care quality standards shortly. I'm going to go to Marg as an advocate. What does the new Charter of Aged Care...
Pat, but that's okay.
Pat, that'd be
You'll
right.
have
I did it
tomorrow.
last time, didn't I? So, Pat.
She's been working with a lot of advocates, which is great.
Yeah, yes, absolutely. What do you see as an advocate, the new Charter of Aged Care Rights? How does it help the consumer?
Well, we all find this is a great new tool. As Craig said, sometimes the older charter, the one that's being replaced by this one, is tucked in with other paperwork. A lot of people, when you enter an aged care home or start receiving home care services, there's lots of information to take in. So you put it all in a folder, put it away, and you may not have looked at it for 10 years, 12 years or 2 years. So this is it's got the respect that it needs as a document to sit down and have someone explain this, all your rights to you. You can ask questions, you can take it at your own pace, you can have someone with you, a family member. You might be doing it in small groups in the aged care setting. So it sets out that it should be explained. It's all about you and what you need and what your wishes are for your care. The last few years, aged care's had a big change. It's called consumer rights now. It's all about the consumer in the middle, and this goes for the Charter and the new standards of care as well. It puts you in the middle, not someone telling you that we can provide you with this and this, is this what you want? And then you have to decide. You might want something that's not introduced to you, and you know exactly what you want. So this is a great document. It's a very powerful tool for you who are receiving aged care services or contemplating to sign an agreement and start taking up aged care services in your area, to keep you at home and to keep you independent and mobile, connected with your community, and then you can connect with us as advocates and have a voice. So we look after all the care recipients in New South Wales. There are 8 services all around Australia, so we look after everyone in New South Wales, and you can access this. This is one of the rights, actually, to have access to an aged care advocate, someone who knows about the legislation and what's fair, what's reasonable, and to be able to stand up and explain your wishes to an aged care provider, so your wishes are considered and delivered, hopefully. Mostly they will be delivered with a bit of consultation and asking some questions. Why are you doing it that way? You know, this person has a right, individual right. It's a very powerful tool.
Very powerful.
A lot of people don't like the word customer or consumer, but actually it strengthens your consumer rights. You are receiving services, you are paying money for these services. There's a certain quality and safety which is stated in this group of rights. So we refer to this, as Craig said, every conversation that we have on the phone with people is all about you've got rights and some responsibilities, generally to respect everyone else, and also to challenge the standards of care if that's not what you're receiving in care and services. So it's a great document, and we've had lots of input and lots of people engaging with this, which is fantastic.
Yeah.
It's like a new lease of life for advocacy, because people have a lot more questions about this. What does it mean to me? Which is a great conversation starter.
Yes, of course.
Can I add something?
Of course.
As a legal practitioner, I look at this as in the past. Yes, both Craig and Pat said it's a schedule and something in the back of the contract. But now the the person who is receiving the care as well as the operator or the care provider sign the document. So that's an agreement, and there are more enforceable. It is an enforceable tool.
Yeah, it's up there in front, isn't it? It's no longer tucked away and gathering dust.
It's an agreement, and they are bound by the terms there. So.
It's great, isn't it? Yeah, excellent. And in fact, we've actually made a little video in regards to introducing the new Charter of Aged Care Rights, the explainer video, which we're going to show you very shortly. There'll be some snippets, so I think we are right to go. So.
From the 1st of July 2019, the Australian Government is introducing a new and simpler Charter of Aged Care Rights for anyone receiving aged care services. As a person receiving aged care, you have the same legal rights as all Australians. The Charter of Aged Care Rights add to these and are designed to help you by putting the focus on you, giving you choice and making sure you are treated with respect. This video aims to help you understand these rights and how you can exercise them. We'll go through them briefly now. However, you'll also receive a copy on paper and you can always ask for more information afterwards. Here's a quick look at all 14 of them. You have the right to safe and high-quality care and services. You have the right to be treated with dignity and respect. You have the right to have your identity, culture, and diversity valued and supported. You have the right to live without abuse and neglect.
Yeah, so it is absolutely pivotal that the consumer, as you can see, is at the at the centre of care, and they have a choice in recognising dignity, the right to be treated with dignity and respect. We are now moving across through to the aged care quality standards, and the aged care quality standards will be effective as well from the 1st of July. These provide a framework for what high and good quality care should look like, and marry quite closely to, sorry, there's a bit of noise going on there and I'm just losing it. So let's talk about the aged care quality standards. Craig, do you have a mic nearby?
I do now.
Thanks.
This is one of these things you just roll with it as there's noise and that sort of thing. The best laid plans of mice and men. Yes. So the new quality standards come in from the 1st of July as well. So everything's happening. So for all those who are receiving aged care services, you might see that your providers are a little bit tired and busy. That's partly because the government saw that there was a need to really set expectations and set that this is a new era. And people would have probably heard about that there's a Royal Commission on at the moment. And one of the things we advocated for at the systemic level as OPAN is we didn't want the government or the aged care industry to, I suppose, rest on its laurels and say, well, let's just wait till the Royal Commission comes and that sort of thing. And I have to say, the aged care industry and the consumer organisations have been really strong about this and saying, no, we're going to keep moving to improving things, and we're going to keep improving things over time, and we will listen to what happens with the Royal Commission, but we don't want to just wait.
Yep.
And so part of that is a new set of standards and assessing against those standards. For the first time, the consumer, there's a little graphic that goes on this that may come up in a minute, and it at the centre really shows that the older person, what in this government language is consumer, but we're really talking about the older person, as Pat said. That's about you. You are at the centre of this. You are the most important person in this whole relationship. And so this is really about bringing the focus on it. And then saying all the other things that come with aged care. It's about your social care. It's about the clinical and nursing things they do. It's about the assessments. It's about the food. And it's about the environment that you live in. all those things should actually deliver things for you. And the standards actually start to spell that out. And it says, as a consumer, as an older person who's receiving aged care, this is what you can expect from your service, and tells the providers, we're going to assess you against that and how well you do on that. And then it says again, then there's a charter to actually say, and I suppose bring that to life from the older person's perspective of what they can expect.
Yes, I often see it as like a hand in glove. One is the absolute framework of what constructually we need, and the other is the humanistic values, the colour. The charter is the colour of the individual to add to that structure.
I think it's a really great way to describe it.
Yeah.
It's hand in glove. You can't have one without the other. And it's the public-facing articulation of what good, quality and safe aged care services look like.
Good. Excellent. I'm going to go to you, Pat. For you and the in your role as advocacy or an advocate, and I guess coming into residential aged care facilities, but also into home care packages and whatnot, does the structure, the quality aged care standards and the charter, do they assist in getting what you require for your consumer?
Definitely, as you just said, they do. They merge very well together. That one's related to the other, and we can easily, like dignity and respect. It's written there. You can say yes, that's in this document. It's also in your standards, which standard it relates to. There's 8 new standards, so that's from the 44 that were in aged care into 8, and then 22 from home care into 8. So we could cross-reference one to the other. So they reinforce, both documents reinforce the other one.
Beautiful.
And strengthen your rights in every area. You know, what you wish, what you need, what your involvement in planning for your needs, consultation, communication again, diet and all those things. Food is very valuable to say. Everyone's got something to say about food. It's very important for our health and our well-being and our happiness. It's a very social time. So
And feedback.
And yes, and feedback, how to speak up if there's something that's not quite right. So, you know, from every aspect, from what you want, the person's in the middle of this the diagram. If you're living in an aged care facility, you've probably seen these little posters all the way around that has a consumer in the middle, and then it's a little wheel and all the spokes of the other services. So it's all about rights, how to speak up if you're not quite happy, because if you're not happy, then other people probably aren't happy either. And if someone speaks up sometime, you'll be able to lift the standards of care and improve it for everyone.
Yeah, it's all about communicating, isn't it? We won't know what you need until you tell us what it is and what we can help you with. Fantastic. So we're going to look again at another video, or a continuation of our video of the new charter. And this will be looking at rights 5 through to 10. And then when we come back from that, we're going to discuss our favourite right.
You have the right to be informed about your care and services in a way you understand. And you have the right to have access to information about yourself, including information about your rights, care and services. You have the right to have control over and make choices about your care, personal and social life, including where choices involve personal risk. You have the right to have control over and to make decisions about the personal aspects of your daily life, financial affairs and possessions. You have the right to your independence. You have the right to be listened to and understood. You have the right to have a person of your choice, including an aged care advocate, support you or speak on your behalf. You have the right to complain, free from reprisal, and to have your complaints dealt with fairly and promptly. You have the right to personal privacy, and to have your personal information protected. And finally, you have the right to exercise your rights without it adversely affecting the way you are treated.
Excellent. So we took you right through to the 14 because we felt actually it would be a bit difficult to talk about your favourite right if you didn't know all your rights, and that's what we're here about today, to inform you of the wonderful Charter of Aged Care Rights. So Maria Berry, what is your favourite right?
Well, my favourite right is number 7 because I'm a bit of a rebel on the risk side of things.
I think you're a rebel.
Risk has been a conversation that's actually come up with several of the webinars, particularly in Albury, where a lot of organisations and managers are finding this conversation a little bit challenging because there's safety and there's all of the above. And the discussion comes up all the time. I like risk because it's enabling and empowering and giving voice back to older people, in that they are all individuals and that they can express and live and have some rights and say within their lives. And I just think that's so important. In the past, people go into residential care and they lose their identity and their person. They lose sometimes their right with their culture, their diversity and all of that respect that comes. So this is really putting it out there on the table, and it's going to challenge everybody into how we're going to actually do this. But I'm very much for rights and very much for enabling some things in life. If you decide you'd like to do this or that, or you would like to go to the pub and have a beer, that's your right. And I think we have to enable some more choices around risk. So,
I guess that's, you've really picked out some pivotal points there in that we listen and really listen to the person who's come to us with a wealth of understanding, knowledge, experience, and they could actually teach us a whole lot of things if we just sat down, had that conversation. Yeah. I really love the guy parachuting. I think that's fantastic. And Marg Crothers was actually telling me a wonderful story about someone that actually had done that recently. So that's fantastic. So Pat, what is your favourite risk? Right.
My favourite risk.
Ooh.
Well, I support all those risks, as you say, to live a full life. I watched the 75th anniversary of the May Day. The older chap back into a parachute and jumping over a plane. So anyone in aged care home, we hear lots of stories about that. Hot air balloons, deep sea fishing, not diving, maybe fishing, not bungee jumping, but you can take risks. Even go bowling and things like that. What if you fell? What if you fall when you're bowling? Basic things that we hear a lot, that people have been blocked from doing their favourite activities. So that's also a good one. And for me, it was very hard to choose one. You say, choose one? I want all of them. And for me, as I'm getting a bit older myself now, and nursing background, I like number 1, safe and high quality care and services. So if someone's listening to me, seeing what I need from top to toe, making sure I get to all my doctor's appointments and things like that, looking at my diet, I assume they'd be communicating with me. So I think that one will cover just about all the other things as well.
Beautiful.
So that's why I like 1 at the moment. It could change, but 1's at the moment is good.
Yes. I find that mine change frequently as well. So Nalika, what is your favourite right?
Well, again, it's really hard to find, pick one. But coming back to number 2 is my favourite, which I think it's actually, encompasses everything, which is treated with dignity and respect. So when you're talking about individual, it is the whole person, even though you referred to as a consumer, that's the whole person. It's there, and so that person comes with wealth of knowledge, experience, and cultural backgrounds. It's everything there. So, so respecting that, dignity as a person. When someone entering into a care facility, they don't leave like the personality
At the door.
behind.
That's exactly right.
So treating with that. So that comes with the whether I wanted to choose that the person wants to choose this and that or the control. Everything comes within that.
Yeah.
I think that. Yeah.
I think it's really interesting, isn't it, how they're all kind of almost interlinked and intertwined, and it's hard to pull them apart because they do all work together at the 14. You'd expect me to always say that the right to an advocate, number 11, is really important, but the other one we've had a lot of feedback on, Marie, is around that need to listen.
Correct.
And understand or explain things in a way that's easy and to understand. And the importance of understanding, I think, was very pertinent, because it's not just giving people information, it's actually checking in with them. So the provider has a responsibility to check in. Did you understand what was presented to you? And explaining the rights, and the actual aged care providers are now by law have to actually explain this to you, but in a way that you can understand, that's easy to understand, in a format you understand. Could be the video that helps you understand it, but it might be about sitting down and having a cup of coffee or a cup of tea and actually going through it over a couple of sittings and unpacking of what it means to you. So it's fascinating how they all work together.
Yeah, it's an interwoven fabric of life, really, isn't it? The rights.
Yeah.
And I agree with you. Sitting down and listening is only just the little bit compartment of the whole understanding. And the more I do this, the more I discuss it with people, the more perspectives that we get as part of this great panel and this wonderful job. I have to say, pretty good job. I'm learning more about people. Understanding isn't just a one conversation. It's actually, if it's in residential aged care or if someone's coming into your home, it's about understanding your home and what you fill your home with, and your rights and dignity within that home that is to be respected.
Yeah, and understanding, I suppose, where you've come from as a person and someone in life. And there's a group called, I think it's Mindful Living, and they talk about the 10 things that you don't know about me, and actually unpacking that. That's part of right number 3, about respecting culture and those sorts of things. And we don't check ourselves at the door when we start receiving aged care. So it's really important that people's culture's respected, their backgrounds, where they came from, and their likes are really respected and looked after as well.
And the experiences they went through throughout
Yeah.
their life. A good example, like once we had a case where they, the way they contacted us because there was a assault, but the problem was that the older person's the history, the background, because it whatever the care worker is doing is triggering his the past. So the understanding of that, so it's very important.
And I think this is where it comes back to that focus, that the provider needs to understand these components so that they can remove that trigger and make the consumer feel safe again. And
and also supported.
Yeah.
The person is supported with the care provision.
Isn't it amazing? I mean, this is about a dynamic shift, and I think that sometimes
New paradigm.
New paradigm, and also that we can't underestimate how it can make you feel that you're not in control or you don't have power anymore. And this really says, the Charter of Aged Care Rights says, you do have power, you do have control. And obviously, unfortunately, unnaturally, when there's someone providing services with you or to you, it does have a power differential. And this is about resetting that. So that this is about an equal partnership between the aged care provider and the older person who says, this is how I want things done. It's a great opportunity to have a conversation.
Yeah, it's fantastic. Maria, I can see you doing lots of nodding. Do you want... Oh, it's great nodding. Would you like to add something to that?
I think a story. I recall when I started my nursing, and I didn't know the 99-year-old lady that I was about to assist with personal care in the shower. And when I turned the water on, she literally jumped out of her seat and was screaming and had a fist up in the air. This lady, I later found out, she was a victim of a serious assault in her lifetime. And I guess somebody else on the panel came up with something and said that, somebody goes into residential care and they don't know the person that comes in to deliver that care. Shouldn't we get to know the person first? You know, have a story, have a conversation. We're all busy, we're documenting and doing all of that, but we still really need to get back to knowing the person and the story, because everyone's individual. Yeah.
Absolutely. And that brings up, the providers are going to have to find innovative ways to provide opportunities for these conversations and time to get to know. I think also the rights, and we chatted about this earlier, that you take them on personally and you reflect upon your own practice and your own interactions, etc. So I know for myself, I still work in intensive care. I'm taking far longer to explain things and actually listening a bit more than talking, which is a bit difficult for me. All right, beautiful. We're next talking about consumer responsibilities. So with any right that you have, you also need to acknowledge the rights of everyone else. And aged care is often in a community that you're sharing with many others. And consumer responsibilities, I guess responsibilities were once part of the 4 charters in the title, but now they are engrounded within the rights themselves. I'm going to go to you, Pat. Consumer responsibilities. What do you think they are, and what do we need to be mindful of?
Well, I think the first one is dignity and respect for everyone. So the people coming into your home, or the aged care workers in your aged care home, also deserve respect from everyone, and dignity to do their job and have their cultures recognised as well. And so a lot of these you can almost say, well, these are almost human rights or universal rights. So if everyone's clear on what this means, I think naturally it will go to whoever's coming into my environment to look after me. I'm going to start to practice that myself. So hopefully that will come. And the conversations that the aged care workers and managers will have with each older person and their families or representatives, they will have a chance to be listened to and heard and tell stories. As probably, I didn't know that about that man. He's been here 5 years. I've never had a conversation with him, and he's lovely. He's got a wonderful past.
Yeah.
So I'm sure there'll be lots of those stories that we're going to hear from staff when we continue to provide these webinars and conversations to staff as well.
Yeah. Again, it comes back to that conversation and getting to know. It really is just that essence of getting to know the person next to you, isn't it?
So the
Hello.
so the responsibilities are also to look after your health, like the one that's still in place now, the Charter of Rights and Responsibilities, to look after your health and take your medication. And if you're not happy about something, talk to your doctor.
Yeah.
So we'll continue as advocates to have those conversations with you as consumers or residents in aged care. If you're not sure, you can ask someone, a family member, staff member. Definitely call us, get someone to help you, call us, and we'll talk about your responsibilities or what you should do. Because if you refuse to take medications or things like that, there may be consequences. So as advocates, we can explain that to you, that you need some explanations quickly from a doctor or a helpline. There's lots of different places you can go now for information. Poison information, or nurses on 000. So there's lots of resources we get you to access your rights and responsibilities about taking medication or leaving the aged care home, things like that. Yes.
Great.
So they're written in other places, not on this document, but they are still in the Aged Care Act and other documents. And all this will be explained to you as well as just this one page, the Charter. So this will be explained to you with these conversations you'll have with your aged care provider. And hopefully you'll have an interpreter if you need that as well, so you can understand these in your languages. And probably Craig will talk about this later. These will be translated into several languages as well.
Absolutely. And again, it's taking time and really looking at all the resources, and it's not a one-off conversation. Yeah. We've actually made another component of the video, explainer video, about what's next, and that looks at the consumer responsibilities.
So, what's next? While you have these rights, you must respect the rights of others in the aged care community too. Everyone should feel safe and respected. And you may need to consider any existing care agreements previously made with your provider. Shortly, your provider will give you a copy of the Charter of Aged Care Rights. All Australian government-funded aged care providers have an obligation to explain these rights to you in a way that you understand. We recommend sharing the Charter with your family, friends, or anyone helping you with your care. It's a great opportunity for you to discuss what's important to you. Discussing your rights and needs better enables those around you to help deliver the best care possible.
Love that little angry man.
He's my favourite. He gets happier though, that's really nice.
It's because
when someone listens to him and understands what his expectations are and his needs are.
Yeah.
Yeah.
And there was an advocate there as well as the provider, and support and communication. It's great.
And I think that's an important thing to say, that you probably see our number around and it's in the video, but 1800 700 600, that gets you to an aged care advocate in your state and territory. It flows down, that's one national number and it's a free call, but that gets you through to whoever is the provider of aged care advocacy services in your state and territory. So don't worry if someone else answers the phone. It's one of our services that are doing the National Aged Care Advocacy Program.
Yeah.
They're available 8 a.m. to 8 p.m, Monday to Friday.
Great, that's good. Yeah. So there's many names, isn't there? There's Zira and Atticus, ADA.
Yep. Darwin
so
Community
Seniors'
Legal
Rights,
Service.
Yeah,
There's a number
Catholic
of places.
Care.
Yep.
So absolutely, 1800 700 600. All right, so we're now looking at the template for signing, which it encompasses the 14 rights, and then it has an area for signing. And I guess we're looking at what's the purpose of signing, is it a difficult process, and who needs to do it? And I'm going to go across to you, Craig. The signing, let's talk about that.
Okay, so in a nutshell, the Minister for Aged Care, Ken Wyatt, when he was the Minister a few months ago, had asked about, he saw this as a really important thing, that people understood their rights. But he was worried that people would just say, here you go, and that was it. What the provider is doing by signing this is they're saying that they understand that you've got rights and that they're going to respect those rights. So they have the responsibility to do the signing as well as the explaining. As the older person or the family member, you might be the authorised representative or the power of attorney for someone. What you're doing is saying, yes, I've been given a copy of this, I acknowledge that, and I understand that you're going to try and protect my rights or my loved one's rights. So that's what that agreement is, and it's actually acknowledging the two-way relationship here. So it's not, in one sense, it's not a new contract per se, but as Nalika was saying, it is an agreement.
Yep.
We agree to, as an aged care provider, to respect your rights, and it's the documentation and acknowledgement of that. So that's why it's really important. And we'll talk about timeframes, how long people have got to bring this in in a short time. There's a little bit of time, so people have got time to sit down and explain it to you as well.
Yeah, absolutely. There's still time, and there's always time to have these conversations. It's effective 1st of July. Nalika, I'm going to ask you, and you mentioned it before, signing, what does it mean for you, do you think?
Well, signing means, like, you are taking the responsibility, and also it creates a legal binding as to, like, if someone breaches.
Breaches,
So then
okay.
there are some implication it can impose on. So therefore, that's why it's important for the older person or their legal representative to talk to the aged care advocates, each state and territory, so then they understand, and also they understand to discuss with the service provider. And so this is one of the things that even Seniors' Rights Service we are advocating in terms of how we can go further in terms of supporting the older persons to getting their legal rights protected in terms of taking this further.
So it is official. I think that's, I suppose, the thing is that, and people have been asking me, even some of the providers, can we add extra things in here? And I'm saying no. The Charter is the Charter. It is the 14 rights. If there is something else that people want to explain around, you need to pay your bill on time, that sort of thing. And I'm saying, of course, older people understand they've got to pay bills. They've been paying bills their whole life. But if someone feels that they need to, I suppose, set out where and when and which bank account for that to go in, all those sorts of things, that's fine. But that's separate to this. This is the standalone one-page, easy to understand, 14 rights. So that's the important thing. And we do talk about people need to understand if there's other funding agreements and things that might need, possibly they might need a little bit of a refresh, because they'll be referring to this and they've been referring to the old Charter before. So we can understand why providers might be having some of these conversations with you over time about what needs updating. But the 14 is the 14. The Charter is the Charter, and this is the Charter from 1 July 2019.
And I believe anyone can sign it as long as they understand the Charter themselves, have a
Yeah.
rapport with the consumer.
Yep. So particularly on the so it could be the direct care, the person coming into your home providing that care and support. I can imagine they might sit down with this video on their phone and say, "Watch the video, and I'll go and make you a cup of tea, and let's come back and have a conversation about this." It could even be, I suppose, if the cleaner who's coming into your room in a residential facility, if they've been trained in this and can explain it to you, great. And what a great way to have a conversation and start talking about it. Could be the nurse, it could be your case manager, could be a number of people. The providers have got options, but the person we're saying is the person needs to be, they need to understand what your rights are as well.
Yeah. Again, it's an opportunity for them to grow, learn and reflect in their own practice and understanding. So the timeline for implementing the new Charter is coming up. There are different dates though for new residents, residents already in care, home care and community care. I'm getting the wrap up here. So do you want to tell me them quickly?
Sure. So there was acknowledgement that it might take a little bit of time to get to everyone. And so the government's given a bit of a time frame. For people who are new, coming into a new aged care package or coming into a residential facility for the first time, they have to start using this from 1 July. But the providers have been given to the 30th September to work through the people who might currently be in residential aged care, and to the 31st of December for people who are receiving a home care package. For those of you out there who are receiving the Commonwealth Home Support Program, they are still working through some of those stages. But I mean, we're sort of saying to people, let's start a conversation, start it early. You will be given a copy of it before in the next couple of months. That's what's important. And you can always ring us on 1800 700 600 and have a conversation about what this means for you.
Beautiful. Yeah. So OPAN have created a few documents so that can assist in having that conversation and understanding the new Charter of Aged Care Rights. One of them are the webinars that we are presenting, and they're all available on opan.com.au/charter. And you'll find many different ones over the last couple of weeks that we have done. There are community events happening also under opan.com.au. There is a booklet that is now released by the Department of Health. We will find that for...
Yeah, so there'll be a link to that booklet, which is the government's explainer booklet, I suppose, in print, and that's going to be translated into a number of languages. They're available for the Department of Health website, but we'll put a link up on that. Providers will have copies of that as well. It's just the process of, it's available for download now, but will be printed over time.
Beautiful. And of course, our explainer video, the great video that really does very simply and clearly provide information on the new Charter of Aged Care Rights. So I'd like to thank you all for being with us today and your wonderful input and experience. Thank you so much. And we're going to leave today with Lila. Lila is at Wodonga in Westmont Aged Care Facility, and she's going to read out the Charter of Aged Care Rights. I thank you for your input today and have a lovely afternoon.
All information about myself, including information about my rights, care and services. I have the right to control over and make choices about my care and personal and social life, including where the choices involve personal risk. I have the right to control over and make decisions about the personal aspects of my daily life, financial affairs and possessions. I have the right to my independence, like that. I have to be listened to and understood. I have the right to have a person of my choice, including an aged care advocate, support me or speak on my behalf. I have the right to complain free from reprisal and have my complaints dealt with fairly and promptly. I have the right to personal privacy and to have my personal information protected. I have the right to exercise my rights without adversely affecting the way I am treated.
The provider has to, by law, sign for it. They have to tell you about your rights or provide information about your rights in a manner that you can understand. And as you're aware, across residential aged care, there are many different levels of capacity and ability. And so therefore we have to meet everybody's needs, not just one cohort of people. It needs to be done to everybody, or for everybody, I should say. So, what would be your right that you feel that you really need while you're here?
I'd like to get out of here.
What was that?
I'd like to get out of here.
Yes, I'm sure.
Yeah.
Okay. And that's underlying it as well, isn't it? Like, we can be rosy and I can say, you've got rights and you've got a voice, but the reality is I leave here at the end of this session. Yeah.
And with Brian, I suppose the brain's still quite okay,
Yes.
but the body's worn out.
Yes.
And he's been a farmer and a very good sportsman.
Okay.
And all of a sudden, he's in a room being lifted and, relying on the nurses to come when he needs to go to the toilet, and they can't come, and then he feels guilty because, they're all good to him. Yes, there's certainly are, but I just say it's just, and degrading for you, isn't it? When I say it's degrading for you, when you get to this stage when you've been so independent.
Everything.
Everything,
Yes.
that's right.
And